Hi, my name is Dr. Michelle Cotty, and today we're going to talk about anxiety disorders. Most of us have felt normal anxiety at some point in our life, and that's a healthy response. It can make us feel more motivated to get things done. But that would be considered mild anxiety. Other people have moderate anxiety, which may leave them with tense muscles or feeling agitated. Some people, though, suffer with severe anxiety. And this inhibits their ability to function normally in daily situations. They may have ritualistic behavior or not be able to respond to daily stress.
Here are the objectives for the course. Compare normal and pathological anxiety. Differentiate between types of anxiety disorders. Identify predisposing factors in the development of anxiety. Identify expected findings for various anxiety disorders. Formulate interventions for a client with anxiety disorder. And describe types of therapy to reduce symptoms of anxiety disorders.
There are several types of anxiety disorders. Separation anxiety is when the individual fears being separated from someone they're emotionally attached to. Phobias can be the fear of objects or situations and an irrational fear. So it might be snakes, even though there are no snakes in the house or they're not around. Maybe they're afraid, though they don't want to go outside because they don't want to see a snake. And agoraphobia is when the individual has an extreme fear of certain places. So when we think of agoraphobia, people tend to stay inside where they feel more safe and less vulnerable. Social anxiety is excessive fear of social situations. Panic disorder is when an individual has recurrent panic attacks, and generalized anxiety disorder is when an individual has excessive worry for at least 6 months. Obsessive compulsive disorder and the related disorders listed below aren't exactly anxiety disorders, but they are listed here. So, obsessive compulsive disorder, the individual might have intrusive thoughts. These thoughts could be religious, violent, or sexual in nature. Or they could have compulsive behaviors like repetitive cleaning, washing hands. Hoarding disorder is when the individual has difficulty parting with possessions and things that they own, and this results in extreme stress and functional impairments. And body dysmorphic disorder, so preoccupation with perceived flaws or defects in physical appearance. So anxiety disorders have some risk factors that we'll discuss now. First of all, they are more common in females. And I'm not sure if that's because they are overdiagnosed in females, that men maybe don't go to the doctor to talk about them as much, or if they're actually more common. Acute medical conditions can cause anxiety. So hyperthyroidism can make an individual feel more anxious. Something like a pulmonary embolism would increase anxiety. Anytime that a person is tachycardic, they're likely to feel more anxious, or if they have hypertension. Medications like steroids, for example, can make a person feel more anxious, and substance abuse. There are many screening tools to rate levels of anxiety, and those include the Hamilton Rating Scale for anxiety. There's a fear questionnaire that looks at phobias, Panic Disorder Severity Scale, Yale-Brown Obsessive Compulsive Scale, a Hoarding Scale Self-Report, and the GAD-7. So expected findings in anxiety disorders is the topic that we're going to discuss next. And I started with generalized anxiety disorder because this is the disorder we see diagnosed most often. So to be diagnosed with generalized anxiety disorder, you should have uncontrollable or excessive worry almost daily for at least 6 months. Now, this worry would need to cause significant impairment in several areas, like work, home, school, socially. The individual may experience restlessness, muscle tension, procrastination, sleep disturbance. They might avoid doing stressful activities or events, and have a hard time getting ready to do things. So maybe they take a very long time to get ready to go to work or to go out, or they cancel a lot. Next, we have separation anxiety disorder. And when an individual is separated from their loved one with whom they have an emotional attachment, they're going to experience excessive levels of anxiety. These levels of anxiety will disrupt their ability to participate in daily routine activities. So they may experience headache, nausea, vomiting, sleep disturbance. And sometimes we'll see this in animals also. When an owner goes to work, the dog just paces, and makes themselves sick. It can also happen with humans. When people are not together, sometimes the separation anxiety that an individual experiences is so bad that it disrupts their ability to participate in daily activities. Now we're going to talk about phobias and expected findings. With specific phobias, the individual may have a fear of specific objects. Spiders, snakes, strangers. Individuals may have a fear of specific experiences like flying, being in the dark, or an elevator. The thought of the fear, not just seeing the spider or seeing the snake, but thinking about the spider or thinking about the snake, that thought can actually increase their anxiety. And for some individuals, they try to cope by using alcohol or other substances. Agoraphobia is when the individual avoids places or situations that cause anxiety. And this might disrupt the client's ability to go to work or participate in regular activities. A lot of times, this leads to the individual not wanting to leave their home. Their fear of the danger is disproportionate to the actual danger of the situation. Social phobia. The expecting findings would include difficulty being in a group setting. These individuals might have a really hard time performing or speaking in front of other people. You can see in the photo the woman at a work meeting. For people who have social phobias, this situation would be debilitating. They become consumed with worry about poor performance or doing or saying something wrong that would cause them embarrassment. Panic disorder. These panic attacks typically last 15 to 30 minutes. And the individual would have 4 or more of the following symptoms during a panic attack. They may experience heart palpitations, shortness of breath, feeling like they're choking or being smothered, chest pain, nausea. They may feel depersonalization, which is kind of like a disconnection from the world, fear of dying, or that they're losing their mind, chills or hot flashes. Obsessive-compulsive disorders include OCD. Again, this is where the individual has unwanted or repeated thoughts. These could be violent, religious, or sexual in nature. Feelings, ideas, sensations, or behaviors that drive them to do something repeatedly. It can be very time-consuming. With hoarding disorder, individuals save items regardless of value. So sometimes they save things including trash. This results in social and occupational impairment and can lead to a really unsafe living environment. In body dysmorphic disorder, clients attempt to conceal a perceived physical flaw, so it may not be real. They compare themselves to others all the time. They might be obsessed with looking at themselves in the mirror. And all of these disorders result in impaired social or occupational functioning. When we are providing nursing care to individuals with anxiety disorders, we want to keep a structured interview to keep the client focused and to help them be present. Always look for comorbid conditions, including substance use disorder or medical disorders or medications that may increase anxiety. Make sure that the individual is safe and not at risk for suicide or self-harm. Remain with the individual if they are so anxious that they're unable to self-soothe. We want the environment to feel calm and therapeutic, which can be challenging in an inpatient situation. We want to teach the individual relaxation techniques, encourage positive statements, and identify defense mechanisms that could interfere with their ability to recover. Obviously, we're not going to do any teaching if the individual is having a panic attack or such severe anxiety they can't concentrate or learn in that minute. And then at that point, we need to wait for the medications to kick in so that we can have a more therapeutic relationship. Medications for anxiety include SSRIs, SNRIs, which would be second line, and anti-anxiety medications. So benzodiazepines would be for short-term use, and buspirone can help with anxiety, especially in the elderly population. Therapy can also help with anxiety symptoms. And for mild anxiety, an individual may not need medication. They may benefit more from therapy. So cognitive behavioral therapy can help an individual identify their negative thinking patterns and help challenge and change cognitive distortions. Relaxation training can help control pain, tension, and anxiety. Modeling is when an individual imitates the behavior that they want to have in a stressful situation. It's kind of like role play. Systematic desensitization. So the individual, if they are scared of snakes, perhaps, they're exposed to increasing levels of anxiety-producing stimulus. So maybe they are exposed to a picture of a snake, then a rubber snake, then an actual snake. And while that's happening, they would use relaxation techniques to overcome the resulting anxiety. Flooding is when the individual has a great deal of undesirable stimulus in order to turn off the anxiety response. So again, that's good for phobias. So we expose the individual to a great deal of undesirable stimulus, so say a pit of snakes, in order to attempt to turn the anxiety response off. Response prevention is when the individual has a compulsive behavior. This type of therapy focuses on preventing them from performing that, with the intent the anxiety will get less when their compulsions are less. And thought stopping involves teaching the client to say stop when the negative thought or compulsive thought behavior arrives, and then we substitute it with a different type of behavior or positive thinking. So the one that we'll talk about mostly during this course is cognitive behavioral therapy. Remember, when you're talking to patients, to educate them on monitoring for signs and symptoms of anxiety, to notify the provider if there are any side effects from the medication, not to stop or increase medication without asking, and to look at what coping mechanisms are working, what aren't working to control the anxiety. We want them to pick from the healthy coping bucket, not the unhealthy coping bucket. We want them to use alternative stress relief and coping mechanisms that will help with the efficacy of medication and decrease the need for medication in some cases. Here are the references, and again, these lectures are taken from your ATI book. For